So today, as we all know, we are talking about clinical documentation skills. So I'm so happy that Dr. Anthony has given me a very brief introduction about me. So I believe that I'll straight away go to the session. So today we will be having or I'll be covering these following contents. So we will start with the foundation of the clinical documentations. We will also learn about the case history taking, which will be the major part of our session. We will talk about the personal histories, family histories, and then we will talk about I'll touch upon MSc, mental status examination, because I request the participants to mute your audio so that we can have good communication. There is no any hindrances in between. Yeah, thank you so much. So I'll be touching upon the mental status examination as well, and we'll be talking about the psychosocial formulation. We'll be talking about the genogram here as well. This two important thing, case history taking and genogram, will be of major focus in our session for today. All right. Now, before we get into the topic of case history taking, I want you people to understand few important foundations of what we call it as a clinical documentation. Now, by the term clinical documentation itself, we can say that it refers to the systematic, accurate, and professional recording of client information. Now, what would be the client information here? The clinical observations that you're doing as I believe that majority of us are from either social work background or a psychology background. So what we observe during our interview or during our client interaction and the kind of assessments we do, the kind of interventions we happen to do with the client and the outcomes that we got. Okay. So clinical documentation refers to all these informations for your very kind information. Now, when we talk about clinical documentation, since we are more of social work and psychology professionals here, now, in social work, what do we say? In social work, we see a human being in connection with the environment. We see how a human being is connected to a social, cultural, and the other religious aspect of the person. We see about the social institution that is available for the person. We see the strength, the systems of the person here. We are more focusing on the strength based rather than the symptom based, right? Or we can say rather than the deficit based. Okay, so that's how social workers will be dealing with the case history taking. Now, when we talk about the psychological perspective, now they see in terms of the interpersonal and psychological functioning. They see it in terms of symptom based, symptom focused. They see it in terms of diagnostic focus. They see it in terms of therapeutic progress. All right, so likewise, in both of these disciplines, we look into a person in different aspects. Okay, so but both these aspects are for the welfare of our client. Okay, so please keep that in your mind. Now, when we talk about clinical documentation or documentation as a clinical skill, clinical documentation is not a clerical skill, it's a clinical skill. So, kindly have it in your mind. Why we call it as a clinical skill is the first one is requires clinical assessment. Now, when do we say something is having a clinical assessment is we are not just writing the verbatim report. Now, I believe that all of you know the meaning of the term verbatim. We are not exactly writing. I mean, not all of the time we are not going to write exactly what the client is talking about, right? So it requires clinical assessment, which means this assessment will be based on your observation. This will be based on the interviews. Okay. Now, say for example, the client says that somewhere the client says that the client has got some, he or she is unable to sleep. Okay. So, a poor documentation or the so-called clerical documentation will include client has sleep problems. Okay. So that will not be a clinical assessment. All right. What would be a clinical assessment for that particular problem? Okay. The client is saying that I have got sleep problem. All right. So rather than just including it as client has sleep problems, a professional who will be showing their knowledge, a professional who will be systematically observing and assessing the client with the help of interviews would mention it, saying the client reports trouble in sleeping, okay, trouble or difficulty in initiating sleep. So what is the client does? So the client is feeling difficulty in initiating the sleep. Hardly he sleeps for 3 to 5 hours. Apart from that, or 3 to 4 hours, apart from that, the client is feeling worried about his life. Okay. So this is what is the example of a clinical assessment. All right. So documentation is a clinical skill rather than a clerical skill because it requires clinical assessment. Point number one. It involves selective attention, right? When we say selective attention, we are not supposed to write each and everything that the client talks to us. Okay, so the clients might be saying that, okay, yesterday I went to the market and then I met my cousin and then we spoke about different things. I came to my home. I spoke with my parents. I spoke with my brother, and then I spoke with them. I fought with them. So this might be a number of things the clients might be saying to you. But as a professional, as a mental health professional, or as a health professional, you are supposed to take only few things which are clinically needed. Okay. So I mean, it is not needed for me to write the client has went to the market, the client has been speaking like this, all these things. It's not needed. Okay. So whatever is necessary, you are writing it. Say, for example, the client would be, would have spoken about multiple things to you. All right. So multiple things would have spoken about the parents and everything and anything. How can we, if it's a poor documentation, how do they write? They write that the client was talking with the parents, the grandparents, siblings, neighbors, community. Okay, so it's not needed. How do you say sometimes looking into the problem properly? What does the client speak to these people? What does the client speak to the parents or the grandparents or the siblings? Okay. So there lies your professionalism. So how do we write instead of just writing that the client was talking to all these people? How do we write? We can say that, I mean, as per the interview, as per the informations that you have got, my client would have been talking about the problem. Okay, he might feel that, he or she might feel that the parents and their since they are not supportive towards him or her, that is a main problem uh, for him right now. Okay, so this is the main content of the discussion he or she had with all these people. All right. So only a professional who can involve in a clinical interview or observations can select these kind of activities. Okay. So it's not necessary that you write A to Z whatever the client has been talking about. You can include whichever is relevant to the clinical piece. Are you all with me? Am I going very fast? Kindly let me know. Maybe if it is so, kindly let me know, or else it's okay. Yeah. Thank you. Now, the third important point why we call it as a clinical skill is it requires therapeutic understanding. Now, when we say therapeutic understanding, whatever the problem the client is talking about, you are supposed to relate it to the problem, okay? Related to the client's expressed or unexpressed issue. Now, say for example, your client would come to you and say that, that I'm scared of exams. Okay, I'm scared of examinations. That is the word that your client is saying. Until and unless you are a professional, a health professional, or a mental health professional, you will have to look into look or dive deep into that particular term as well. Okay. Now, what do we have to talk about when she says that I'm scared of examination? The poor documentation would be client is anxious about exams. Okay, the client is anxious about exams. This would be the poor documentation. As a good clinician, what you can write is if the you have to dive deep into that anxiousness that has been caused because of exam. So your client might say that, okay, I am scared because if I'm not scoring good marks, my parents will not, my parents will scold me, and they always compare me with my elder brother. Because my elder brother scores good, they want me to also score like him. Okay, so these are the few hints that your client will be talking to you. You as a professional, with the help of therapeutic understanding, you come to a with the help of the information that has been provided, we have to document in such a way that it is understandable. So how do we change it? Like, client is feeling anxious for exam. Okay, how do we change it? We can say that client reports anxiety towards exam, thinking that failure can lead to problem in the home, okay, or problem in the house, or problems with the parents. They are majorly comparing with the siblings. Okay, so client is feeling stressed, or client is distressed about the exam, which is why she's feeling anxious, right? This is what is therapeutic understanding. So just like that, we cannot say that he or she is anxious in the exam. What is the reason behind that anxiousness? Whatever is happening, there is a reason for each and everything. Okay, so you have to consider that in that perspective. Then, documentation influences diagnosis, intervention, and continuity of care. Now, when you have documented each and everything, that will help in the diagnosis process. Okay, the client will be sharing n number of things. The client will be talking about major number of things. Okay, it will be, he or she will be talking about the symptoms. So that will help you in the diagnostic process. With the help of the symptoms, with the help of the case history, with the help of all other assessment, you can plan what kind of intervention is needed for the client. Okay, or in social work we say psychosocial community based rehabilitation, we say family intervention, and in psychology we say what kind of therapies can be used for this particular person. Do we have to incorporate cognitive behavior therapy, or just a solution focused therapy can work out for this person? So this documentation will help you in planning the intervention and also the continuity of the care. With the help of these documentation, you can see whether the client has been improved, or the client has been doing well, or the care has not been, the treatment process is not being achieved by the client properly. So documentation as a clinical skill requires majorly these four important points, which is why we call it as a clinical skill rather than a clerical skill. So, in order to do all these activities, there is a need for a professional like you and I, as a psychiatric social worker, or as a social worker, or as a psychologist, to deal with the clients. Okay, so everything that needs to be documented. So if you fail to document, you will miss the track. You will miss the track to help the client to overcome their problems. All right. So when we talk about the documentation, there are different things that you have to consider in your mind, especially the ethical, legal, and professional importance. Okay. Now, when we talk about the ethical points, ethically, the case history or the documentation has to be confidential. All right. When we say confidential, that doesn't mean that only myself. Okay. So if I am handling the client, only I can see the file. No, not like that. The authoritative people, or the people in the centers, they can access the file. Okay. But then apart from that, Apart from those people, nobody else is supposed to have the access for the files or for the documentation, whatever we have done, which is why in many places, even when we go as interns, okay, when we send our students as interns to different places, they will be retrieved or they will not be allowed to get the access of the case notes, okay, because ethically confidentiality has to be maintained. That is one point. Informed consent. Okay, many of us don't do this. Many of us, don't do. We don't ask the consent from the from our client because we have to ask the consent from the client saying that we are documenting different the whatever is needed for the to support the illness or to get away from the illness. I am going to document few things which will be used for the treatment purpose alone. Likewise, we have to get the consent. Now when we say about the informed consent, it doesn't mean that you have to get the signature from the client and all these kind of things. No, but at least a verbal information and your case record should have the line saying that informed consent has been obtained from the client. Okay, that is again an important one. And then accuracy and non-judgmental attitude. Now, when we say accuracy, non-judgmental attitude, the notes, whatever, or the history, whatever you're taking, it should be it should be objective, it should be respectful, and it should be having factual language. Okay. Say, for example, client is careless and irresponsible. Okay. Can we have this line in the case note, in the case history, or in the clinical documentation? Can we have this line? Client is careless and irresponsible. Can we have that? Can I get some messages? I believe all of you are following. All right. So, yeah, anyways, all right, no, not an issue. Can we have the term saying client is careless and irresponsible? No, we are not supposed to have that. You are not the person to decide who or what the client is. In fact, how we can write is we can say that client reports difficulty in handling financial activities. So, client reports difficulty in handling financial stress and emotionally unstable. So, likewise, you can be able to write in your notes, in the clinical notes. Okay. So, your language, the kind of language that you are using, will reflect your empathy and will reflect your professionalism as well. Okay. That will reflect your fairness as well. All right. And when we talk about the legal aspect, it is more important to document the necessary things in your case, in the case history taking or in the clinical documentation. Now, why do we need this legal point is because if at all assume that the client has been going through some domestic violence or abuse at the home, when you mention it in the case history or in the genogram, it's a very accurate proof to, to support the client. Say, for example, people are visiting, even the police people are visiting, are concerned to ask or to get the clarity about this. Your clinical documentation will help the client more properly. Okay. Now, I would like to share one incident when we talk about the legal aspects. See, properly documenting the aspects or the concerns that your client has been talking is more important. I happen to see a client who would be almost around, this is just a couple of years ago, who will be almost around in his at that time he was in his 35 to 40 years of old. Okay, so he is married, he has got children, and he was having it okay. But then within a time span of around 1 or 2 years back, he started to have attraction towards persons of same sex. Okay, so he started to have the attraction. But what happened was he started to feel guilt about that particular attraction. So he is attracted towards people of same sex. But then he's also started to have a kind of guilt on, guilt regarding that, because he's married, and you know how the situation will be when we talk about a rural place in India. Okay, so he has been repeatedly coming to me. He has been in the facility. I was talking to him. I was encouraging him. I was helping him to, we were intact in the treatment. But all of a sudden, one day, what happened was he committed suicide. Okay, so he committed suicide without, and the family is unaware of this. The family doesn't know what has happened. The family is clueless about why this person has committed such a way. So what happened was, even the policemen started to search for the search for evidences, like they started to gather information why this person has committed suicide. So end of the day, they have visited our concern as well. So we were saved because we had the proper documentation of the information that the client gave. So I have very clearly mentioned about the fact that he is having, he has shared that he is having an attraction towards the opposite, towards the same sex, and he is also feeling that this is not good and I am not fit for living. I have a kind of suicidal ideation. So, luckily, we have mentioned it, or we have mentioned it in the case note that has saved our concern. Okay, since we are dealing with the people's mental health and we are dealing with the people's emotions, we have to document everything that is related to the disorders. Okay, that is related to the person's mental health. Okay, so all these things will be useful even if you might be running, or you might be into an private you might be practicing it privately, you might be having clients like this. Okay, you might be having clients with different problems as well. But when you document each and everything properly, we will also not be in trouble. Okay, so legally we need to have, or we need to have a very good documentation. Just imagine if I would not have documented it there, he would, he just committed suicide after 1 or 2 days of our visit, okay, of our consultation. So just imagine, we would have been under a problem, right? So this is also a kind of, evidence that you have documented everything properly, and you don't have any issues, or you didn't do anything wrong. All right, and this will also protect from malpractices. We will be accountable for having whatever we have written it. And on top of that, when you write, okay, say for example, we are all social workers. So I have written some notes, or I have written about my client, and I feel that my client is in need of we can say cognitive behavior therapy. My client is in need of CBT. So the professional importance here is, with the help of my notes, I can also refer to a psychologist. Okay, I can refer to a psychologist so that she can, she can also help my clients. I can also refer my client to the vocational training. I can also refer my client to occupational therapy. So likewise, the interdisciplinary communication, for that we can have, we need this documentation. Okay. Now, what are the common documentation errors that we can see when we are documenting? So, the main and the first important point is, we as caseworkers, or we as professionals, what we do is, we just write what we think. We don't write what we see, what we hear, what we observe. Okay. So we just write what we think. So I think that my client is, my client is irresponsible. So it is not that client is irresponsible. My client is finding it difficult to handle some things, right? So both has got differences. So one important error is that you are not supposed to write your opinion. You are supposed to write what you have seen, what you have heard, and what you have observed. Okay, that is one point. Use diagnostic labels prematurely, which means before diagnose. Okay, I mean, we know that the diagnosis comes after the assessment, right? But just because my client says that I am sad, so I diagnose my client saying that my client is having depression. Okay, so no, that's not the case, right? We have to assess them properly, and then we have to go for diagnosis. What happens with many of the many of the case workers here is that they just diagnose before assessment itself, which should be avoided. We are not supposed to use some vague, incomplete terms like normal, poor, unstable. Say, for example, my client has, the client has got unstable unstable sleep. Okay, client is improved. Improved in terms of what? Okay, so that all these things have to be noted. Client is normal. Now, what do we mean by normal here? Okay, or client is poor. Poor in terms of what? Poor in terms of attention. Poor in terms of orientation. What? Okay. So we are supposed to avoid these kind of terms as well. Then we are not supposed to just copy paste the information that we got from that we had from the previous session. Say for example, previously my client would have said that the client, he or she is having good sleep, and he or she is talking about suicidal ideation. Okay, let us imagine that. Now, instead of just copying that again for the next review, I have to check whether the client is improved or not from the last session. Okay, does the suicidal ideation is still persisting, or is it being reduced, or the client is very serious about the suicidal ideations? Okay, so everything has to be noted as per the present scenario, not with the older one. Okay, so that is also a problem, a documentation error. And missing client voice. Sometimes it is needed that you have to document the verbatim report of the client. You have to document what the client is talking about. Say, for example, in we can say that I say that the client is very unstable. Okay, the client is very unstable. Here, unstable doesn't give any meaning. So sometimes I can write that my client feels, overwhelmed, and she feels difficult to function, or difficult for to cope up with the daily functionings. Okay, so verbatim report as per the client says. Client says that I am overwhelmed. I couldn't follow the daily activities. Sometimes it is needed that you have to just keep this client's note as it is. Okay. So wherever it is needed, you are supposed to keep it. Okay. Then overlooking cultural context. Now this is one of the most important thing here. Okay, so overlooking cultural context is you have to be culturally sensitive, which I always use it with my people. Culturally sensitive in the sense, if my client says that I will listen to my parents, or I will listen to my my family members, we are not supposed to say that my client is my client doesn't have a stable decision making. No, it is not that way. It is because we have been culturally, they have been trained. Okay, which means my client would be respecting the decision of elders or decision of the family members. Okay, so there we have to consider it properly. Okay, so cultural context is also important. Now, say for example, a person with mental illness, what do they do? Sometimes what happens, not majority of the times, first they will speak with the family elders. Whatever the people are saying, they will be following that. Then they will be going for the spiritual places. They will go to the religious places. They will feel that okay, my mental health will be improved if I go to the religious places. Okay, so that doesn't mean that I cannot blame my client saying my client has been irresponsible for treatment, or has been to treatment after a very long time when the situation has been totally worsened. Okay, I should not blame my client. Instead, I have to look into the we as the professional, we have to look into the cultural context. My client has accepted or has respected the opinions of the family members. All right. So likewise, you have to keep it in your mind. You have to respect them. Then key important conceptual differences which you have to understand is case history. One is a case history, which is the narrative of the client. Like what is the client's story? That is what is case history is about. What is the client's story? Okay. Case record. This is a complete official file which will include all the records. This will include the basic informations of the client, wherever he has been. Okay, all the reports connected to him, the referrals will be there, and maybe the payments will be there, all the reports will be there. So everything, it's a complete official file. Case formulation is you are analyzing like why is the problem occurring to this person and what is the fact that it is maintaining the problem. Okay. So likewise, you have to analyze and come to a conclusion here. Clinical notes are nothing but the session-wise progress. Okay, if my client is visiting for today, I will write his progress for today. And next week, if he is visiting, I will again write his progress. So these are the four important terms that you have to understand. Only now we are entering into our important term, that important form, that is case history taking. Okay. Now, how do we collect the case histories? All right. This is the most important part of the assessment, your assessment part. All right. Now, the case history taking has got a number of activities to be done. The very first point is the identification details. All right. Now, when we say identification details, now you are getting the basic information of the client. You can include, the you are including the name of the client, age, gender, the education, occupation. So likewise, the basic informations you are giving. And on top of that, you are also writing the key informant here. Okay. The key informant could be any family member, a friend, a teacher, anybody. Okay. Key informant is nothing but the person who has been accompanied with the client to share more information about the client. Sometimes in some places the key informant can also be the client. Okay, so the client can also be the key informant here. So this is the first thing that we have to do it, identification details, wherein this is understanding the basics or the basic informations, personal informations about the client. Okay. And then we are going to talk about the presenting problems, which means the chief complaints. Okay. So why this has to be in the verbatim report? That means this has to be in the client's words, presenting problems. Okay. What are the problems that the client says? All right. So the client might be saying that I'm unable to eat properly, I'm unable to sleep properly, I'm unable to work properly. So likewise, whatever the problems the client or the chief complaints the client is saying, you are going to record it one by one. Okay. So point number one, loss of sleep. Point number two, appetite problems. So likewise, we are going to mention everything. That is the presenting problems. Here, you have to also mention the duration, severity, and progression. Okay. Now, when I say duration, sometimes the clients might say that I have been having problem in sleeping for the last 1 month. Okay. Then she or he would say that no, I have a problem of laughing to myself for the past 3 months. All right. So each symptom has got its own onset. Okay. Each symptom has got its own duration. You have to also chronologically understand which symptom has been the first symptom. Sometimes the key informant as well as the client might say that everything was started with the everything has been started with the problem in sleep. Okay, let us assume that was the first problem. So on top of that, what happened? First, the insomnia happened, trouble sleep happened. then problem in appetite happened, then disorganized speech happened, which means they are not able to speak properly, then poor self-care has come up. So likewise, your presenting problem should not be only the symptoms, it should include the duration of the illness, it should include the severity of the problem, it should include the progression, which was the first problem for the client, which was the first symptom for the client. That should be in a very depth way in the presenting problems uh, point. Okay. Then the next one is history of present illness. Okay, we call it as HOPI, history of present illness. Now, this should be a kind of story. This should be a kind of storytelling. All right. So it could be as much as the story is about. So history of present illness. The beauty lies in the case manager on or the clinician's way of writing. All right. So history of present illness. How I usually tell to my students is that you have to write the basic details of the person. Say, for example, Mr. A. Okay, Mr. A, Mr. A is a 45-year-old male working as a carpenter in the rural area of Telangana state. Okay, the rural area of Telangana state. He is married and has two children, two girl children. He is right now residing in so and so place. Okay, so I am giving the basic details about the client in the first passage. Okay, so following that, what I have to say is the client was apparently doing good till 2021. All right. Now, here is where you have to ask questions with the client and the caregivers saying that, okay, you are talking about talking to self, laughing to self, and everything. Now tell me, when did this first start? Okay. So they might say that, okay, this started before 6 months, before 8 months. They might say in that way. So what you have to do is you have to again probe. Now, how do we probe? We have to ask questions saying, all right, so you were saying that, the problem has arrived or has been for the last 6 months. Now, can you tell me, were there any events or were there any problem that occurred at that particular time? All right. Now, sometimes the informant might say that, yeah, my son has been, an alcoholic, and his wife has left him because he's an alcoholic. He doesn't go for work. He doesn't give the money to the family. All right. Since she went, my son has been like this. All right. So here you have to make a note of that incident as well. So how we are supposed to write is, in the first paragraph, I have given the identification detail of the client. In the second paragraph, I will write, the client was apparently doing good till the year 2022. After that, the client's wife, since the client's wife left him because of his alcoholism and his irresponsible, not irresponsible, and his he wasn't be able to financially help the family, his wife left him. So likewise, you have to write the history of present illness in a detailed, in a narrative style, in a kind of storytelling style. Okay. So that's how you're supposed to write it. So after that incident, the client has been
Ma'am,
started to, yes,
ma'am, could you have any sample of any case history that you can show to us?
sample of case history. You mean
Yes,
any
ma'am.
case
Can
study
you?
kind of? Yeah, yeah, I will be sharing it maybe possibly by the end or in the WhatsApp group itself. I will be sharing it. Okay.
Okay, ma'am. Okay.
Yeah. Thank you. So you are supposed to write it in that way. Okay. So that was a problem. And because of that problem, the client started to develop, maybe he started to develop sadness. He started to have intense crying. He started to have difficulty in falling asleep. He started to have difficulty in having food. So likewise, you have to narrate it in such a way that the person who is reading it should also understand, right? So the which means the doctor or any other professionals. So they should also understand it, and it should be a kind of narrative way. All right. So that's how we are supposed to write it. And in order to get or seek help for all these matters, the client has come to our facility. That is how you have to end your history of present illness. Okay. Your basic details, the chief complaints, then your narrative incidences of the problem that the client has been having. All right. Followed by that, you are further assessing different aspects of the client. Okay. You're further talking about the history of the client. All right. So you are right. You are starting it from the prenatal and birth history, which means you are seeing whether the client is a full-term baby or did the client cry during birth. All the birth aspects have been, were intact. All these things. Were there any maternal complications for the client during birth? So likewise, you are also probing on that. And then we are moving on to the developmental milestones. You are checking whether the client has whether the client has got all the developmental milestones properly, or whether it was a delayed milestone, or it was about the motor milestones, the language, the social interactions. All these milestones have to be dealt with here. And then we go for the childhood and adolescence history. Now, when we talk about the childhood and adolescence history, here we have to majorly talk about the school adjustment. We have to talk about the peer relationship. Was the client able to have good life in the school where he or she is having good relationship in the school? So likewise, you have to check. Okay. Was he or she is having good friendships, good friends? Likewise, you have to talk about, you have to find out. Okay. And then talking about the educational history, whether the client has got good academic performances, whether the client has got any learning difficulties, so that you have to probe in the educational history. Then comes the occupational history, where the client able to have good job satisfaction, or he or she is having work stress. Or one important thing is the client shifting from n number of occupations? The client is unable to be stable in one particular occupation. Is the client has been shifting to one and the other kind of occupations? That is also one important thing that you have to look into when we talk about the occupational history. And then the marital and sexual history, if it is appropriate, you have to ask for this as well. Does the client has any relationship problem, any adjustmental issues, any sexual problems? So all these things you have to note it down here. Okay. Then one important thing is the family history. Okay. Now in family history, you have to talk about whether the client has, the structure of the family, whether the client has been in the nuclear or joint family or extended family, what kind of relationships the family members have there, are they emotionally connected, what kind of communication patterns the people follow, the family members follow there, what is there any history of genetic hereditary patterns, or is there any history of the family problems, gene problems? So likewise, you have to talk about all these things in the family history. One important component that has to be drawn when we talk about the family history is the genogram. Okay. Now we know that genogram is a graphical representation of a family. Now, what do we represent in that particular graphic or in that particular drawing is that we represent the biological and legal relationships between the family members. We are showing the patterns, or we are showing the transgenerational problems. It could be the genetical problems. It could be, equalitarian problems. All these points, the repetitive patterns of communications, patterns of roles, all these things we are projecting on that. We are also giving the health, psychological, and social issues, whatever the family has been going through. Might be the family might have been going through a kind of social issues, might be casteism, might be class problem. All these things we are documenting that as well. We are also documenting the kind of emotional bonding, the communication patterns that the family members are having towards each other. That is also an important one. Now, family, as I have said, holds a very important place when we talk about the case history, because here you can, we all know that family is the very first social institution that any individual will experience. Okay. So majority of our traits, majority of our habits, our behavior are being influenced by our family. So it is necessary that you have a genogram of the client so that you can understand whether the client's vulnerability, risk, and everything. All right. So there are different types of genograms here. So basic genogram, emotional genogram, medical genogram, cultural timeline genogram. Now when we talk about the basic genogram, which is nothing but the basic informations will be there, like the foundation of all other genograms. It will include, the different, the family members, parents. See, genogram should be for at least 3 generations. Okay, clients 3 generations. It could be it could be if I am the client, my parents, my grandparents, right from my grandparents, the genogram should be drawn. Okay, so that's the basic point. Basic genogram is nothing but you are simply just showing the different people in the family. You're just showing their how they are connected and what kind of the communication they have. So likewise you're simply showing it. That is what is basic genogram is about. The second one is the emotional genogram. So when we say emotional genogram, here you are explaining the emotional dynamics which is there in the family. Okay, emotional dynamics. Let us assume that in a family, the mother and the son might be having a good bond. Okay, they might be having a strong bond, whereas the father and the daughter might be having conflicts. Okay, they might be having a number of conflicts in the family. All right. So, emotional genogram will explain the emotional dynamics of the family. Since we are dealing with mental health, we know that how or the role of the family is more important in terms of having or promoting good mental health for any individual. Okay, so emotional genogram here, as I have said, it talks about the emotional dynamics in the family. Who are being connected so much, who are not being connected here, who is so, out of the group. So, likewise, emotional genogram will give you a picture about the emotions that has been going through in the family. All right. Then we have got the medical genogram. So, the medical genogram will identify the health risk, will identify the vulnerabilities that are prevalent in the family. Then we have got the cultural or social genogram. Now, when we talk about the cultural or social genogram, here we can understand the cultural influences of the family. We can understand the social identity of the family here. We can understand, the rural-urban migrant families. How are they being connected here? So all these kind of activities can be projected here in the cultural or social genogram. Now, say for example, it's been very common that a person from rural area will be, migrating towards urban area for job purposes. Okay, so he or she, I mean, he would be leaving his family in his hometown and he'll be moving out to urban area for job purposes. Okay, they have a very strong cultural feel that even if he is leaving his family here, the person's brothers or person's extended family or religious practices and extended family can still take care of his own family in the village, right? So, connecting or showing all these things will be included in the cultural or social genogram. Like, what are the different religious practices or cultural points that are being included. And the next one is timeline genogram. When we say timeline genogram, it is nothing but it identifies when the problem has emerged and how other events have got connected. So when the problem of trouble in sleep has emerged, and following that, how job loss has happened, how marital conflict has happened, how falling into depression has happened. So it's a timeline genogram. Here, most importantly, we have to see emotional genogram and the basic genogram. That's more, you understand it. So I'll explain the different symbols that are used in the genogram. All right. Now, these are, considering the time, I will explain the symbols as well. While drawing the genogram, you have to mention, for male, you have to include it as the square. For female, it is circle. You know it very clearly, so I'm not getting into this much. So for in order to mention with age, you can mention it. You can just write it. Okay, you can just mention it in the boxes. The male is 47 years old. Female is also 47 years. Here, death, age at death. Death includes having, cross here. Okay. So when you cross the table, it means that the person is deceased. Okay. The person is no more. So when you're writing the age, I mean, here you can write at what age the client or the person has been dead. Say, for example, if you're drawing the genogram and the grandparents would have died at the age of 80, you are writing it like that. Okay, so that's how it is. So birth, death, and age, you are including it. And for the other genders also, if it's a gay, you can mention it likewise, and lesbian, bisexual, and if it's a bisexual male, this is bisexual female. Okay, you have to remember it. And even for the transgender male to female, transgender female to male, institution, if you're talking about any institutions, it could be social, financial, economical, religious institutions, you can show it in this image. And then if it's a pet, you are showing it like this. Pregnancy, here the gender of or the sex of the fetus will not be known, right? So showing triangle here. So that is how you are showing it. Now, here lived in more than two cultures. Now, when we say lived in more than two cultures, this is for the male and this is for female. Okay. So when we say for more than two culture here, we are referring to people who have experienced or who have adapted to or influenced by multiple cultural contexts. Okay. Say, for example, somebody who has been born in a rural area, he or she would have completed her studies in the urban area. Okay. And for job purpose, they are moving to abroad. All right. So they have been with these two cultures, right? So being in the rural culture is one, being in the urban culture is number two, and then going to abroad is number three. Okay. So the person who lived in more than two cultures, we can refer it like this. So even minute things are also important here. Immigration is if I am moving for a long-term settlement or permanently if I am moving to abroad for job, to permanently reside there, we can mention it in these these shapes. Okay, this is for male and this is for female. In two cultures, there is only one curve. Here for immigration, there is two curves here. Okay, so that's how you have to remember. So basic genogram symbols I have just told you. Now index person is your client. Okay, keep that in your mind. Index person is your client, and you have seen. I mean, I have told you about the age and things. And then deceased, as I have told you, the person who is no more. If it's a male, you have to show it like this. If it's a female, it is like this. If it's a miscarriage, you have to show it like this. If it's an abortion, this is an accidental one. Abortion is a planned one, so you have to show it like this. Okay. And then male stillbirth, female stillbirth. So stillbirth, we know it, death of the fetus before or during birth. Okay. So, especially after it has reached a viable stage of pregnancy, which means after it has according to the World Health Organization, after the fetus has reached 28 weeks of pregnancy and the fetus has been no more, then we call it as, if it's a male child, it's a male stillbirth, female means it's a female stillbirth. Okay, miscarriage and abortion is different. Even the minute things are important, please keep it in your mind. Now, coming to the important emotional aspects of the family relationships here, each term is important and I want you people to just listen it properly. This is marriage, okay? So a male and a female has been connected by marriage. So you're showing a proper, line. Engaged, male and female has been engaged, but they are not married. It is just a confirmation that they will be getting married. All right. Separation in fact, okay? Now, separation in fact is they are living apart without court order. Say, for example, the people who are, a couple might be having some marital conflict, okay? So these couple are having some marital conflict. They find it very difficult to stay in the same house, okay? So what do? They are not legally, separated. They live apart, okay? So they live in two different places but they are not separated. Okay, so there is no, their marriage is still alive. Okay, they are not able to sort it down, nothing. They are just living apart to because they find it that the marital life is not improved, or that's not good for them. So separation in fact, there is no legal thing happens here. Okay, now I have a question. So, a person who is in long distance relationships, let us assume that the husband would have gone to another place for job and the wife would be staying in another place with the kid and something like that. Can we say it as separation in fact?
No, ma'am.
No, we are not supposed to say it, right? Because here the marriage is very live, right? So the marriage is, the marriage life is intact. They are having good relationship. Whereas two people who are fighting and they have marital conflict there, because of the marital conflict, they have moved to two different places. Okay, there is no legal procedures happening here in separation. In fact, all right. Now, another one is the legal separation. All right. So, when we say legal separation, they have been legally or they have got, with the help of the court order, they are staying in two different places. All right. Even now, their marriage is alive. Okay. I mean, their marriage is actually intact. Okay. Which means they find it difficult to live with each other. So, with the help of court order, they have been separated. They are only living in two different places, but their marriage is still working. Okay, here what happens here is that they are together for some family responsibilities, for some maintenance, for the custody of children. They are together. Okay, which means together in the sense they are not legally.
Ma'am,
Yes, yes, please.
ma'am, legal separations. We can say that also some case is going on in court.
Mhm.
There is no divorce.
Yeah, see, legal separation and divorce is different. Okay, I will come to that. Legal separation is they cannot marry. Okay, they cannot remarry here. All right, they will be married. These couple will be married. They are just staying in two different places because of marital conflict. Because this is because they have to take care of their responsibilities. Okay, so person or the couple, whoever is in the legal separation, they cannot go for the remarriage. Okay, so with the help of the court order, you can also ask me that, saying that, can we assume that this is the duration before they get divorced? No. Sometimes legal separation can also be a longer process. All right. So legal separation is
Okay.
legally both these people are accepting the fact that they are having some responsibilities in the family. They have to go for this maintenance and they have to go for the custody of the children. Okay. Now let me tell you one more example. Here in legal separation, it is mandatory that any one spouse or the spouse has to give alimony to the female. Okay, so maintenance charges, like let us assume monthly 10,000 or 15,000 has to be given to the female. Here legal separation, it is mandatory. All right, let me come to divorce here. Now here divorce, the marriage has been dissolved. Okay, so these people have, or these people can go for remarriage. I mean, they can go for another marriage, right? So even here, they will be backed by the maintenance. They'll be also having the custody of children here. One important thing is that in divorce, the alimony is not mandatory. All right. So if the wife says that, okay, I have got enough money or I don't want your money, so the alimony is not mandatory here. All right. In legal separation, it is mandatory. That's the one important differences which we can find it. Okay. So divorce is, these two people have, they have been, their marriage is totally dissolved here. They can choose their life, whatever they want to be. Okay. Whereas legal separation, it is not. Their marriage is not dissolved there. All right. They have to be, they will be called as married there. All right. So they are just separated and living in different places for some reasons. That's what. Then this is engagement and separation. So they both are engaged, but due to some conflicts, they are separated. That is what engagement and separation. This is widow. Engagement and cohabitation is living together. They, both of these people are engaged and they are living together till they get married. Okay, so that is what engagement and cohabitation. This is only living together. Okay, so cohabitation. Cohabitation is only living together. Legal cohabitation here is even living together. Can people mute your audio if there is nothing to speak? Yeah. Thank you. So, legal cohabitation is, even live-in relationship has got legal law and they have been accepted in many countries. In India, we are finding it difficult to accept that. But when you take other countries, we can find that after certain period of time, the living together couples are can be legally. Can you please mute your audio?
Yeah, now you can proceed, ma'am.
Yes, thank you, sir. Yeah, so here legal cohabitation is legally you are into the live-in relationship. So as I have mentioned, in few countries, the people, I mean, after a certain period of time, they can legally be called as living together couple. Okay, so here we mention this as having love affair between the male and the female here. All right. Now again, I'll take 15 more minutes, sir, if you permit. So. Yeah. So the
Yes,
emotional,
ma'am.
thank you,
Yeah,
sir.
you can proceed, ma'am.
Thank you, sir. Thank you. So the emotional genogram symbols are also more important here. So yes, there are certain terms which I want you people to, have a note on this. So yes, when a male and the female in the families, they are in good, relationships. They are united. They are happy. We call it as harmony. When they are indifferent, when we say indifferent, no, nobody, even the male or the female, they don't care about the other person. Whatever happens, it is just like that. They just move off. Okay. And the other one is love, and this is in love. Okay, when we say love, this is sometimes called as we can, in love is more. They will do they prioritize the other person over everything. Okay, whereas in love it is just the normal one. Here it is not needed that they have to have some romantic relationship. Okay, so if I am loving a person, I just love the person whoever he is. Okay, I just love him for whoever he is. But if I want to involve in any kind of romantic relationship, we call it as in love. Okay, so terms of romantic relationship. That is what you have to remember. Okay, then these two people, a male and the female, is having close friendship, very close or best friendship, and they are having conflicts here. And if people are having hatredness towards each other, we can just connect it likewise, and they want to just cut off the relationship, or they want to just move away from this particular person, we call it like this: hostile. Now when we say hostile, these people are they are more negative. They are having aggressive attitude and behavior towards the opposite person. Okay, so I am much aggressive towards my brother. Okay, so I am hostile towards my brother. Okay, so that's how it works in. So distant, even in hostile, we can see distant, close hostile, fused hostile. So when we say distant hostile, so these people have aggressive behavior towards each other, but then they are more passive. Say for example, in a family, a father and the son, they would have been in a verbal conflict long ago. That is distant hostile. Okay, so even though the father doesn't like the son, or the son doesn't like the father, when they involve in communication there will be aggression there. What do? They just stop communicating with each other. Okay, so the father is much more distant or much more irritated with the mother. Okay, so they just don't talk to each other. All right, so that is what is distant hostile. Then close hostile is they are more controlled. Okay, they are, the communication is controlled here. Say for example, you will not be able to trust the opposite person. Sometimes the opposite person would have shared your secrets with others, so I don't trust the opposite person. So my communication will be restricted. My communication will be very superficial there. I might hide my feelings and show something else to this person. So that is what is close hostile. And then fused hostile is nothing but they will be having a cycle of closeness and conflict, which means they will be extremely, extremely in love with each other, or extremely in connection with each other, extremely close to each other in terms of good happenings. But when they fight, they are extreme in that as well. Okay, so love, closeness will also be extreme. Conflict will also be extreme in terms of fused hostile. Okay, we know about violence, abuse, physical abuse, emotional abuse, sexual, manipulative, controlled, focused on, fan, or admire. When we say focused on, this particular person is more into, as I have said, the male giving more priority to the female. Okay, they will prioritize the person, they will look into them. Fan or admiring, like we take them as a, or this particular individual will take a family member as a role model, or they will admire each and every activities of that particular family member, is what fan or admire is about. So emotional relationship, this I have just gotten clear understanding. This is medical genogram, which majority we don't use it, but for your understanding you can just have it. So suspected physical or psychological illness for the male, you can just see it. Say for example, if the family has got some problem of mental illness, you can share it like this. The female, you can share it like this. And then physical or serious physical or psychological illness, male. Here you are only suspecting it, but here you have concluded that they are having some serious illness. Then here in the recovery phase for male, female, this is about alcohol or drug abuse. All right. So you are confirming it. So here you have to understand, you are suspecting and also you are confirming it. Okay. suspected alcohol and you're confirming the alcohol abuse, and you're also marking the recovery here. You can understand the shapes, okay, how the shapes have been designed. So this is about the drug or alcohol. Here, smoker, you have to mention these words, okay? If it's a smoker male, you are mentioning, the rectangle and the yes here, and then it's a language problem. If the person is finding difficult in communication, he has got some, speaking problem, understanding problem about the languages, you have to mention it like that. Obesity, we know it. Career in male, female here means nothing but the person or the family member will carry the gene of, the previous. Say, for example, a family has got, night blindness. All right. So the mother and the father has got night blindness. All right. So there is a possibility that the son or the daughter will also be getting the night blindness. Okay. So you are having a confusion, or you are in the position that the gene is saying, according to the gene, it is possible that this person might have night blindness. Okay. So you are, okay. So you are just a minute. Oh, yes, no problem. So you are just, having a suspicion, you are just having a kind of, just a moment, people. Let me just connect my, yes, just a moment. Yes, so extremely sorry for that. Yes, so here we are able to see that, in the gene, hereditarily, in the gene, there is a presence of night blindness for that particular person. Okay, so there is, you clear cutly, you have understood that there is a problem. That is what career is about. Affected male, female, suspected, affected, and possibly affected. Now, what is the meaning of suspected, affected, or possibly affected? Suspected affected will show signs and symptoms, okay? Signs and symptoms of a problem, but you need the confirmation by some test, okay? Say, for example, signs and symptoms of, what do we say, of tuberculosis, okay? Signs and symptoms of tuberculosis, but still you need to confirm it with the help of some other test, okay? That is what is suspected affected. And then possibly affected is, here the people are at risk, but they don't show any symptoms, okay? So they are at risk of getting tuberculosis or getting some issue, some illnesses, but they don't show any symptoms, okay? That is what is the difference between suspected and possibly affected. Don't worry if it seems to be so, going very fast. Don't worry, I'll be sharing the recording so you can go through it again and again. Okay, so these are all medical genogram symbols. I have just gotten few for you. Yeah, one important, and we have almost come to, not end, but then I'll try to finish it very fast. So, few things which you have to understand, okay? Premorbid personality. So, which is nothing but how the individual was before the illness, okay? Before the illness or before the problem. So, this refers to the individual's behavior, their emotional responses, their coping mechanisms, their interpersonal functioning. How was the person X before the illness? Okay, so that is what is their premorbid personality is about. So mental status examination, which is, which will almost take a day completely. Okay, 1 hour complete. I needed to talk about mental status examination. Excuse me. So this will also be included in the case history taking. Okay. So as a professional, you have to write the mental status examination as well. Maybe I'll explain this in the next class. I mean, in the next workshop like this. So, this is the most important part of the case history taking. Okay. So, psychosocial formulation. Now, what do we talk about or what do we mean by the psychosocial formulation is whenever you're learning or whenever you are seeing a client, you're gathering their history, you are coming to a conclusion, why, what, all these kind of things. Psychosocial formulation will give you a wider range of idea about that particular person, about that particular illness. Now, this will answer the question of why has it happened to this person and what are the factors that are maintaining the illness. Okay, so that's how you will be, that's what you have to see here. So the predisposing factors. Now predisposing factors are those factors which increases the vulnerability of the client. Say for example, if the client has got the family history of anxiety disorder, the client will be is at a risk of developing anxiety in their age, right? So that is what is predisposing factors. Like what is the point which increases the vulnerability? I have told you genetically or hereditary patterns will speak more in the predisposing factors. Precipitating factors are nothing but the factors that worsens the situation, factors that triggers the situation. Say for example, let us assume that client who has developed anxiety, all right. So this particular person's anxiety will be even more triggered when he or she is experiencing a job loss. Okay, when he or she is experiencing a breakup. Okay, so that is what is precipitating factors. So, which are the factors that is worsening or that is sorry that is triggering anxiety here. All right. So the triggering factors is called as precipitating. Perpetuating factors are the factors which worsen the disorder or which is maintaining the disorder. Say for example, let us assume a 24-year-old girl, she has got the family history of having anxiety. Okay, she has already has got the family history of having anxiety. It is more possible that she might also develop anxiety disorder in the future. Okay, her precipitating factor is that job loss. Okay, she has had a job loss, which has also triggered her anxiety. Now she is anxious as well. Okay, so predisposing factor, she was not anxious, she was only vulnerable to anxiety disorder. Precipitating is because of the triggers she developed anxiety. All right. Moving on to the perpetuating, her anxiety is being maintained because she doesn't communicate with the family members. She avoids friends because she is having some anxiety within her. Okay. So because of this, her illness has been maintained. Okay. That is perpetuating factor. Protective factor is for this disorder, which are the activities or which are the buffer system that is working against her problem. She might be having a very good, friends. She might be having a very supportive friends. She might be having good access to counseling centers. So all these are protective factors. Okay. After the illness, she can get rid of the illness because of these factors. Because she has got good understanding friends, good understanding family members, she is able to get rid of the problem. Okay. So these four important factors are more important when you're talking about the case history taking. Okay. So I have come to the end of our session. So I know this might be a bit heavy for all of you here, but as a professional, when you're dealing with case history taking and the genogram aspects, you have to consider all these things. Maybe if time permits, not time permits, maybe in the next workshop I talk about the mental status examination. So here just a quick wrap up of what we have learned. So we have learned the basics of clinical documentation. We have learned why is it called as a clinical skill and what are the ethical, legal, and professional importance of having a clinical documentation and the different documentation errors that have been encountered by different professionals and then conceptual differences between these terms. We have seen about the case history taking. Yeah, I will share a case. Okay. So, yeah, recordings surely be sharing it. Don't worry, Mr. Rakesh. So I'll share the case history, detailed case history taking which I did. Okay, especially the history of present illness and all. Since somebody was asking, I'll share it in the WhatsApp group, possibly in 1 or 2 days, because I'm out of station for the next few days. So I'll be sharing it. Please be in touch in the WhatsApp group. I'll be sharing it. Okay. And we have seen about the
Okay,
histories.
ma'am.
What are the? Yeah, thank you. We have seen about the histories, genogram, what are the types, and what are the standard symbols and the meaning of those things. Also, we have seen it for today. Yeah, so maybe if you have any questions, you can ask now.